As we all continue to shoulder additional stress through the pandemic, it's being absorbed by children and teens.
It has really challenged children, and we've seen a lot of kids coming in with very higher acuity as far as their symptoms, and more complicated cases that were made more difficult because the pandemic has created fallout in home life, economically, etc.
Cindy Jones is the director of the Psychiatric Intake Response Center, or PIRC, at Children's of Alabama, the tip of the spear for this pediatric mental health crisis. From 2020 to 2021, the PIRC reported a 64% increase in calls and a 72% increase in emergency visits.
September and October were our busiest months, and in fact, the busiest that we've ever had since we started the Psychiatric Intake Response Center.
Since the PIRC opened in 2018, calls and visits ramp up as school resumes and taper off during breaks.
The age range that we see the most is between ages 12 to 15. That typically is the kids who are here presenting with suicidal thinking, maybe homicidal thinking, have a lot of depression and anxiety.
The PIRC at Children's of Alabama is only one of 3 in the country and serves patients statewide. Last year, more than 3,700 adolescents that came through its ER were referred to the PIRC.
We're going to do an evaluation to determine what is the next step, whether that is admission for inpatient stabilization, or it may mean returning to the community with resources that you didn't have before.
It also fielded nearly 3,000 calls from parents, nurses, teachers, and pediatricians.
A lot of people don't know where to go, what to do, who they need. So the value of the PIRC is that we do have licensed clinicians who are able to do a brief assessment on the phone and determine, okay, what is it your child really needs based on the presenting concern.
8 to 9% of those calls refer patients to the closest emergency room. Others are matched with the appropriate care in their community.
Determining, is this a psychiatrist that you need to see for medication management, or does the child need therapy?
The underlying issue for all those referrals, providers are often booked and have a wait list. The smaller the community often means a longer wait or traveling to other areas for care.
The beauty of what we do in the PIRC is that we provide more than one resource to the caller. So we may provide 2, 3, 4, 5 different practices.
Jones encourages everyone to identify mental health concerns and intervene early. For children, that often presents as clingy behavior with caregivers and complaints of headaches or stomach aches. In adolescents, pay attention to changes in behaviors over a period of time. Difficulty focusing, lower grades, lack of interest, and overall disengagement or isolation from friends or family.
You may see children who are acting out at school or running away, who are, like I said, more easily frustrated. So they may be having difficulty following rules at school. That should be a red flag if that's out of character for that child, that they're in crisis.
For those who are suffering, she has this message.
There are, effective mental health treatments that do help children, that do help teens, that can get them through that crisis, and that are extremely effective, so that there is always hope, and that idea that suicide is the solution is absolutely not true.
It's important to note the PIRC is not a crisis or suicide hotline. You can find their number right now on our news app. Jennifer Horton, WBRC, Fox 6 News, on your side.